Hi, I would like to share a case study of how we treat diabetes type 2 patients in our FQAC facility. This is a patient A, 63 years old female client with low literacy level, DM type 2, treated with multiple daily injections and weekly GLP-1s. We were able to fix and control A1C in 3 months with the use of CGMs and insulin carb ratios and multiple daily injections. A patient started with basal dose of 25 units with 2 injections of 12 units for the AM and the PM, and her basal current dose now is 106 total per day, and she's still using 2 injections of 53 units each one. We normally split doses when basal insulin is above 50 units per day to increase the absorption effectiveness. Her bolus dose started at 16 units per day, and now she is at 70 units per day, which is 23 units per meal. We did a 10% increment dose for every visit for the bolus dose. We use a insulin carb ratio system that helps patients to titrate without getting hypos or gaining weight. Patient started at insulin carb ratio of 11 and now is at insulin carb ratio of 2.15. This patient was instructed to follow 130 grams of carbs, and she has been using GLP-1s for the past 2 years with a dose of 0.75 milligrams per week, and her weight has been going down 30 pounds, and the BMI has been decreasing from 39 to 28, even though she has been following multiple daily injections throughout the day. A CGM time in range percentage during year 22 and year 23 increased from 63 to 69 in her last visit, and this has been predicting that the patient has been passing her A1C. The key for success for this case study was a good medical team communication. The second one is use of CGMs and frequent visit, a minimum of 12 sessions per 3 months. It could be in phone or in person. And the other key for success has been the use of insulin carb ratio system and provide enough medication to cover prescriptions. For example, if the patient is using 70 units of bolus per day, we need to provide 70 mLs of insulin to cover 3 months supply, and that way the patient doesn't run low before repeating the next lab. And with that, I am completing my case study. Thank you so much. Okay, this is my second case study, and it's a patient B, a 63 years old female with diabetes type 2 patients on multiple daily injections using CGMs in the past 2 years and using insulin carb ratio system for bolus titration. And since 2022, the team involved in this patient treatment has been about 2 or 3 different nurse practitioners and myself, diabetes educator and dietitian. Patient started with one basal dose injections of 20 units per day. Then she was moved to 2 daily injections of 20 units each, total of 40 units per day. Then she reached a total of 70 units per day, 2 injections of 35 units. Then those started to decrease when bolus dose was added. And now she's back to 1 injections per day with 30 units a day. We were able to control A1C to 7.3 in 3 months after bolus dose was started with insulin carb ratio system. She started with 10 units per day. Now she's following 40 units per day that represent 13 units per meal. Bolus doses were adjusted since she was dropping weight during those months. We started insulin carb ratio of 15 and now she's insulin carb ratio of 3. During the whole process of adjusting basal and bolus doses, she lost 64 pounds by following 130 grams of carbohydrates per day. Time and range progress is showing that once we start covering meals with bolus doses, time and range started to increase and predict adequate A1C for the next lab. Time and range increased from 57 to 60%. The key for success for this case study is, again, good team communication, frequent visits, person or in phone, with the diabetes care and educator specialists to help with titration, minimum of 12 visits per 3 months, and phone or session, and provide enough amount of medication to avoid running low in meds in between labs. And the last one is implementation of insulin carb ratio system, using the insulin management guide developed by myself. And with that, I'm ending my case. Thanks again. Okay, patient C is my last case study that I wanted to share with you. He is a 34 years old male patient with diabetes type 2 and treated with basal and bolus doses. He used about 7 CGMs provided by a FQAC grant. Patient was able to fix A1C from 14 to 8.7 in 3 months without gaining weight and with less than 1% hypos reported in CGMs. He started with 10 units basal dose, and then gradually we increased 10% of the basal dose until reaching 20 units per day. At the same time, bolus dose was added. We started with 10 units of bolus dose per day, that equal to 3 or 4 units per meal. Then we increment dose of 10% every 3 days or every week using different insulin carb ratios. We started insulin carb ratio of 15, and now his insulin carb ratio of 4. That give him about 40 units of bolus dose per day that represent 13 units per meal. Time and range during those years increased from 0 to 73% time and range. A patient is stable now without chronic diseases related to uncontrolled diabetes. And patient dropped 28 pounds during that intervention, and now he is at 27 BMI. With this last case, I conclude my case studies. And I wish I could have more time to share other 20 case studies similar to these ones. Thank you so much.